As a teen, I spent several days a month lying on the bathroom floor, vomiting and clutching my stomach in pain. I did not have an eating disorder or a problem with alcohol. I had and still have endometriosis. I actively fought through the medical system for approximately 5 years to have my pain taken seriously. Today I'm going to talk to you about what endometriosis is, its history of being misdiagnosed, and possible treatments to seek. To understand the pain of endometriosis, you must know what it is. As defined by Dr. George Redman, endometriosis happens when the tissue that lines the uterus grows outside of the uterus and implants itself. The tissue can form scars and cysts that are stimulated by estrogen, making them swell and bleed every month. Some symptoms of endometriosis are intense cramping, pain during sexual intercourse, and pain with bowel movements. This is a small overview of endometrial symptoms. There are 4 stages to endometriosis. Stage 1 is minimal. Stage 2 is mild. Stage 3 is moderate. And Stage 4 is severe. The stages of endometriosis are based on location, amount, depth, and size of endometrial implants. The stage of endometriosis does not correlate with the pain that is felt by the patient. It has been said that individuals with stage 3 and stage 4 endometriosis have no pain at all and show no signs of having the condition. Now that you know what endometriosis is, I'm going to tell you about the history of it being ignored or misdiagnosed, mostly as a mental disease. Similar to labeling women as witches in Salem for practicing medicine, women from the 19th century all the way to 1979 were being diagnosed as having hysteria. When doctors couldn't find a reason for a woman's pain, they referred her to a psychiatrist. Dr. David B. Redwine's wife in 1979 was having pain without cause, which made him believe that he should take a biopsy of her abdomen instead of sending her for mental treatments. Thank God for Dr. Redwine, because I don't know where we'd be if in 1979 we're finally taking someone serious for their pain. During the biopsy, he found that endometrial tissues were outside of the uterus, and that his wife's pain, and possibly the pain of many other patients, was in fact real and not in their head. In addition to overcoming the stereotype of an internal disease, one that does not show physical symptoms on the outside, women all over the world are being misdiagnosed, on average, for 10 to 15 years. Even when women speak up about their pain, they are being diagnosed routinely with IBS, pelvic inflammatory disease, appendicitis, hernia, and gonorrhea. If a patient is lucky enough to be correctly diagnosed with endometriosis, these are the types of treatments that are available currently to them. The first and only definitive way to diagnose endometriosis is through laparoscopic surgery. A doctor will view the organs through an incision in the navel using a tool and look for endometrial tissue implanted outside of the uterus. At this time, the doctor is also able to remove scar tissue and pooled blood. In addition to laparoscopic surgery, a patient can opt to have a hysterectomy. Prior to seeking surgical procedures, many patients are advised to use medicine. The most common is birth control. Most patients feel pain during menstruation, so birth control is used to suppress their cycle and keep their hormones at the same level, stable throughout their cycles. Other medications are used to put patients in a pseudo-menopause. The treatment is similar to birth control as that it keeps the hormones stable, but it's a step up because you have no cycle at all. In conclusion, even with these different treatments, some patients still do not find relief. We have talked about what endometriosis is, its history with misdiagnosis, and various treatments for the disease. I urge you, if you have endometriosis, if you think you have endometriosis, please talk about it. I don't understand how so many women have this. About 10% of the world have this disease, and it is not a national outcry to find more information to treat it. We don't know where it comes from, and to be honest, there are treatments, but they don't always work. Talk about your pain. Get a second opinion if you need one. And if you think you have IBS and you're a woman, make sure you rule out endometriosis first before continuing treatment for your irritable bowels.